We're actually going to start off with our expert interview. So joining me on the line once again is Dr. John Linton, Director of the International Healthcare Center at Severance Hospital. Good morning, Dr. Linton.
Good morning. Thank you for having me on your program.
It's a delight to have you on the show. We've got lots of questions again for you today. Let's start with the cases of reconfirmation or reactivated. You mentioned before that those people who have supposedly been cured of the virus coming down with the virus once again. So there were about 10 cases of these people who were released and then reconfirmed with the virus. How worried should we be about these sort of reactivation cases?
To be very honest with you, we don't have really in-depth knowledge of the virus. And I have seen these reports, and it is very worrisome. However, last night there was a report that we will soon be able to tell by a blood test or serology test whether one is completely immune to the virus or not. In other words, one would assume that those cases were cases that did not build up immunity or adequate immunity, something having to do with their immune systems. And by the way, this is an exception, not the norm. Mm-hmm. But we will soon have a blood test that will tell us if somebody is totally immune and can go back to their workplace. So it is worrisome. It is a problem. We don't understand it clearly, but there is hope that we can distinguish these cases from other cases that are that have regained total immunity, mm-hmm. or have, I shouldn't say regained, but have gained total immunity.
Meanwhile, we don't know if these people who have been reinfected or reactivated, we don't know if they can transmit the virus once again.
They most likely they have been reactivated and they are infectious.
Okay.
More likely than not. Mm-hmm. But again, this is a small group of people. It is worrisome, but it is not. The majority are recovering, developing antibodies in their system, and will not get the infection again.
Okay, good to hear. Of course, starting tomorrow, all people returning to Korea from overseas will be subject to 2 weeks self-quarantine. I just wanted to ask you, what sort of precautions should they be taking, especially if they're returning to family members or they live with other members in the household?
Well, the worrisome thing is asymptomatic people that are carrying the virus. Mm-hmm. And so all precautions, washing hands, in Korea particularly, probably one should avoid eating out of the same side dishes. In other words, using the same container for chopsticks and spoons to go into is not a wise idea. Mm-hmm. Western diets are typically you eat what's in front of you. Probably following that model is safer because, in Asia we share dishes, and so, my chopsticks can go into something that you've eaten. This is probably something that should be corrected. Mm-hmm. All of the other measures are social distancing, even if you live with somebody, is keeping and continually washing your hands, and all the hygienic, the measures that have been brought up cannot be reemphasized greater.
Maybe keeping a mask on as well inside the home, even if you are asymptomatic?
That's probably not that greatly helpful. Mm-hmm. I don't think, obviously if you have symptoms and you're coughing and sneezing, yes, absolutely, keep a mask on. But if you're asymptomatic and you're not coughing and sneezing, that is, I would say, can be looked at. There's a lot of controversy going over that, so right. I don't want to completely say it's not necessary, but at the same time, it's not as important as we thought it was.
Mm-hmm. Just a washing of hands,
That's
personal
correct.
hygiene would be more important. There have been lots of media reports warning about a potential second wave of the virus that may hit come this fall. How likely do you think that this might happen?
We're seeing that in the southern hemisphere where it's getting colder. So according to Dr. Fauci of the CDC, that is definitely a worry and highly likely that we'll see a recycle. Treatments have got to be identified, first of all, and we've got to get this vaccine in whatever shape or form before fall to control the virus. I think we're on a timeline now. We're fighting with time to get the vaccine. If once we have the vaccine on hand, then this epidemic will be under control. But in herd immunity, 60% plus of the population has to have antibodies to this virus before we consider it under complete control. We're not under complete control in just slowing it down. Why are we slowing it down? Because we need to find the treatments and we need to find the vaccine. That is the ultimate solution to the problem.
Mm-hmm. In our earlier interviews, Dr. Linton, though, you mentioned that any vaccine would probably take 12 to maybe 16 months. Do you think that timeline can be moved up considering the global spread and the severity of the disease?
Just recently, there have been some reports from various laboratories throughout the world that there have been some, that there have been some very meaningful early research into this, and I am going to very much hedge. I agree that generally what I said is true, but I think there's a race on in the world, and a lot of smart people, a lot of very dedicated scientists that are working on this. So it is my cautious optimism that this can be pulled up maybe 6 months.
So that would be this fall then that we could
That's
see
correct.
A potential vaccine.
I hope and pray that we have something by early fall.
So in connection with the herd immunity that you mentioned, if we have that vaccine and we have enough of the population that have hopefully recovered from the disease as well, that maybe in the best case scenario by this fall or latest winter, we could have that herd immunity going on?
That's correct.
Okay. One local, among the many companies that you mentioned that are racing ahead with the treatments, one local pharmaceutical company have said that they may be ready for a treatment as early as July. And again, we're still hearing sort of conflicting reports as well. Many experts are saying that they doubt it'll be developed as early as then because clinical trials, they still need to be run to confirm the drug of both its effectiveness and safety again. So understanding the need and the desire to get an early vaccine or treatment, bringing it up by 6 months, can it still sort of safeguard the safety of such vaccines or treatments?
Well, remdesivir, Ebola drug, and HIV drugs, as well as chloroquine, are being studied right now in New York as we speak. So we will have some data from these drugs very, very soon, within a month or two. So the treatment of traditional drugs that we have, and then, of course, newer drugs is also in the pipeline.
Okay. There were also some media reports about how high dosages of vitamin C can potentially help to fight COVID-19, including...
There's no evidence of that.
No evidence.
That has been a theoretical idea for regular influenza, for other common cold. There is no evidence to support that vitamin C does anything for you, other than in natural amounts that you should get daily.
Because those reports said that some cases they actually help to shorten the stay in a hospital, especially the intensive care. But you don't see any truth in that.
Again, I think that evidence is very limited, and I would be very surprised if that were found to be true.
Okay. What about taking a vaccine for pneumonia to potentially sort of protect yourself?
That not for the pneumonia, but the compound, the synergism between a virus, the potential synergism of the virus and pneumonia. It's not necessarily going to help with the virus, but it's just a wise thing to do, is to get the vaccine for pneumococcal pneumonia.
Because I understand the German Chancellor Angela Merkel had also had a shot of that. So maybe this would be a precaution that older, maybe more vulnerable people could take?
That's what I'm saying is that's a general precaution for everybody over 60, 65 anyway. So that is a good idea regardless of the virus.
Right. Very good. We keep hearing also that it's important to stay healthy no matter how long we're cooped up inside and on self-quarantine. We need to boost our immune system. What are your recommendations to boost the immune system?
3 good meals a day, some good exercise. Don't overdo it. Eat good food. And social distancing, I think right now is the key word for the day.
Mm-hmm. Dr. Linton, just one last question to you. With so many imported cases, and we expect the influx to actually increase over the coming days and weeks, Korea has been receiving a lot of praise from overseas for its handling of COVID-19. But I am kind of concerned as a doctor and at the front line of fighting this disease and new cases, how are our medical staff and hospitals coping with the number of patients, and can you maintain this sort of level?
In Korea, we have seen the peak, or we think we've seen the peak, and we're okay. But
you're not too worried about the imported cases?
No. It's been a pleasure to be with you.
It's been a pleasure to speak with you again. Thank you very much, Dr. John Linton.
Thank you. Bye-bye.
That was Dr. John Linton, director of the International Healthcare Center at Severance Hospital.